Hello, everyone. This is Swarnima Bhattacharya. I'm the Chief Product Officer of Gytree, and I'm so pleased to invite all of you to a season of Gytree Dialogues for Women's Health. Now, as we all know, or perhaps we don't, that culture has not only played a role in how women's health is being understood, but also how we're pushing for better health outcomes for women. Women's sociocultural role has historically been situated within the folds of fertility and childbirth, whereas we know that we also need to have conversations around women's mental health, sexual pleasure, aging, aches and pains, and so much more. And it's time to destigmatize them. And that's why we're bringing to you Gytree Dialogues for Women's Health, where we bring across a cross-cultural and multidisciplinary look at women's health, where we're not just talking about the clinical, but we're talking about more than the clinical aspects or the illness aspects of women's health, and looking at the cultural context in which women are situated, which prevents them or helps them to make that decision that I'm going to invest in my health today. And we couldn't think of a better person to kickstart this conversation than Dr. Sudeshna Ray, who is the Chief Medical Director of Gytree. Hello, Dr. Sudeshna. Welcome.
Hello.
Hi. And so Dr. Sudeshna is, of course, she's currently associated with Gytree as Chief Medical Director, but she's been a senior gynecologist for nearly 3 decades. She has recently been, sort of inducted into as a fellow of the, College of, fellow of the Royal College of Obstetricians and Gynecologists in London for her contribution to the science and art of gynecology. And we'll delve into that in a bit, as we speak with her, that why do we say science and art? And also, Dr. You've been associated with Just Look, Breach Candy, Apollo Hospitals, and, suffice it to say that we couldn't have asked for a better person to give us an introduction and give us to highlight the idea that women's health extends way beyond the clinical. And there are so many things, whether you're a woman in the global south or the global north, there are the class situations that permeate your understanding of health and what you consider normal, what you don't consider normal. And we'll have all these wide-ranging conversations with Dr. Sudeshna. Thank you so much, Doctor, once again for joining us. And
my pleasure. It's always so I'm very passionate about when I'm talking about women and women's health. It's not only that not only because I deal with them every day, but also because there's a lot of enigma around it. There's a lot of, mystery to be solved around it. And, it's great always to talk about.
Yeah, you're right. You're absolutely right. I mean, there's a lot of enigma, even when we're talking about, talking about our services to women. There is always this first few minutes where we are trying to burst the myths that people have around certain conditions, and it's only then that we start talking about our services. And so I'm sure you're doing this on a daily basis.
Sometimes just bursting the myths take the whole conversation.
That's exactly.
Yes.
Yeah. So Doctor, getting right to it, you've practiced as a gynecologist for nearly 3 decades, and now you're playing a very important role in what we call the femtech revolution, which has finally found its foothold in India. But we are still, when we are having formal or informal conversations, this question always comes up, but why women's health? Healthcare to healthcare hi hai. Why women's health? And there is, so of course, for us, the answer is very obvious, but out there, why do we sort of need, and why is it the need of the hour to have differentiated healthcare for women? And why do you think, the times of, generic, non-personalized healthcare is kind of a thing of the past?
Right. So it can't be a better question to kickstart the conversation with. The essence of the conversation is why women's health, why do we consider it as a different aspect, completely as a different aspect? Because one, the two most important thing is, one, women are important, and two, women are different. Simply, women are different. So they are anatomically different, they are psychologically different, they are physiologically different, the process as different, their mind thinks differently. So it cannot be the same as any other man. Everything in the women is different, so it needs a different approach. And women are important too, so their bodies are also important, their thoughts are also important. So there are problems which are unique to women. For example, anything related to menstruation is very unique to women, whether it's a period flow, whether it's a period pain, whether it's a problem like a polycystic ovary, whether it's a problem like an endometriosis. These are unique to women. But what's more interesting to find to know is that there are conditions which are different in women. For example, they have a different manifestation. For example, migraines, depression, anxiety, they are the same. They can be in men also, they can be in women also, but in women they have a different manifestation, and hence it cannot be dealt the same way as men. There are problems which are biologically more common in women, like asthma, osteoporosis, arthritis. So these are conditions which are more biologically common in women. So these needs to be it. They need to have an approach which is women centric. So all these makes it a completely different chapter altogether. So healthcare is not the same as anyone else and women. And even within women, it is not the same between the two women.